A study from Europe in 2010, followed by another in England in 2018, showed a startling connection. Taking these medications could more than double your chances of getting dementia. Then, a large analysis involving over 500,000 people highlighted that the same medications upped dementia risk by about 46%. But what exactly is this medication? Why does it seem to lead to dementia? And why are doctors still prescribing it? Over the next few moments, we'll dive into these questions, and I'll also shed light on another long-term health impact these drugs might have. The medication mentioned in these studies isn't just one drug, but a whole group known as anticholinergics. These anticholinergic drugs are medications designed to block the action of acetylcholine. This neurotransmitter is a pivotal chemical messenger in the brain, playing key roles in memory, learning, attention, and muscle coordination. The range of anticholinergic drugs is vast, covering territory from over-the-counter antihistamines like Benadryl to prescription medications for conditions like overactive bladder, including Detrol and Ditropan. These findings aren't just trivial facts. They serve as an important alert for the countless people using these drugs to manage different health problems. These drugs operate by inhibiting the action of acetylcholine, a neurotransmitter integral to memory, learning, and muscle movements. This class of medication encompasses not only antihistamines, but also certain antidepressants and treatments for Parkinson's disease, making its impact widespread across various health conditions and even antidepressants. But why do anticholinergic drugs harbor such a risk? At the heart of the matter is their mechanism of action. By inhibiting acetylcholine, these drugs do more than alleviate physical symptoms. They inadvertently tamper with the cognitive functions governed by this crucial neurotransmitter. Given that a hallmark of Alzheimer's disease, a leading cause of dementia, is the deficiency of acetylcholine, the connection between anticholinergic use and increased dementia risk becomes clearer. Doctors often prescribe these medications because they offer relief for a variety of health issues. For instance, if you're dealing with allergies, medications like Benadryl can be a real lifesaver. The Mayo Clinic notes that over 200,000 Americans each year struggle with overactive bladder syndrome, a condition that makes it hard to control the urge to urinate, leading to potential accidents, disrupted sleep, and possibly even limited social activities. Essentially, your doctor is aiming to help you manage these issues. However, there might be a gap in awareness about the potential long-term side effects of these drugs. They're created and marketed by pharmaceutical companies, whose representatives detail to doctors how these drugs can alleviate patient symptoms. While immediate effects are known, potential long-term risks like dementia may not be fully communicated. Often, the full extent of these risks becomes clear only after many years of widespread use, at which point the medication has become a standard option in medical treatment. Take, for instance, the National Institute of Health's information on Detrol, a drug commonly prescribed for overactive bladder. It lists side effects such as dry mouth, constipation, and dizziness, but mentions little about the potential for causing dementia. This omission is critical, especially for patients with existing neurological conditions, underscoring the importance of being cautious and informed about the medications we use. If you're finding this content valuable, do us a favor and hit that like button and subscribe to our channel. This helps us keep providing in-depth videos like this one. Now, back to the discussion. In this landscape, knowledge is power. For those concerned about their or their loved one's medication regimens, a useful tool is a website set up by two doctors from the UK, known as ACB Calculator, found at www.acbcalc.com. ACB stands for Anticholinergic Cognitive Burden, which is a way to measure the effect these drugs might have on you. Doctors know that these medications can have side effects, and those can be more intense with stronger doses or when mixing with different anticholinergics. Plus, as we get older, our bodies don't handle medications as well as they used to, making us more prone to these side effects. The ACB Calculator helps gauge this impact, providing a useful guide to discuss medication adjustments for older patients. For instance, if you input a drug like Detrol into the calculator, it shows a high anticholinergic burden, rated at a 3, the top of the scale. Benadryl ranks the same. So, if you're worried about your medications, this calculator can be a great first step to understanding their potential impact. After that, it's a good idea to have a conversation with your doctor about any possible changes needed. Moreover, the impact of anticholinergic drugs extends beyond the individual to the healthcare system at large. Research has linked their use not only to increased dementia risk, but also to a heightened need for healthcare services, including hospital admissions. This broader implication underscores the urgency of addressing the use of these medications, with as much information and caution as possible. As we wrap up this deep dive into the complex world of anticholinergic drugs, the message is clear: caution is warranted. In navigating the healthcare landscape, armed with knowledge and open dialogue, we can make informed decisions that prioritize long-term cognitive health without compromising on the quality of life today. For those navigating the complex decisions surrounding medication use, remember, you're not alone. The journey to understanding and mitigating the risks associated with anticholinergic drugs is a shared one. By fostering discussions, questioning assumptions, and seeking out reliable information, we can collectively navigate towards safer, healthier outcomes. Thank you for joining me on this exploration of a topic that touches so many lives. If this conversation has sparked questions, concerns, or insights, I encourage you to share them. Together, through informed awareness and informed action, we can tackle the challenges posed by anticholinergic drugs and work towards a future where medication does not come at the expense of our cognitive health.